if you ever experienced fasting before, or if you observe fasting before, and if you have ever experienced a sharp pain between your chest and your belly, it's actually a very common symptom of gastritis. So today, we are going to be looking at how we can overcome this problem or even avoid it during the month of Ramadan. So the speaker that we are very honored to have on board with us today is actually Dr. Chieng a consultant internal physician, gastroenterologist, and hepatologist from Pantai Hospital Ampang here to share with us his insight on Ramadan fasting and digestive disorder. So if you have any burning questions or concerns about the common digestive disorders during Ramadan, don't be shy. Do let us know in the comment box below, and we will get Dr. Chieng to answer them all. Now, please join me in welcoming Dr. Chieng. Hi, Doctor.
Hi, Fatin.
Hi, how are you?
Yes, fine. Thank you for having me here today. And first of all, I'd like to say thank you to Karen to organize the talk tonight. And it's a very nice Friday evening, which everyone can be here, and then we share this topic together. Thank you.
We are the one who should be thanking you, Doctor, for spending your Friday evening with us. Okay,
yeah,
Doctor.
Now we still talk about today. There's a traffic jam, heavy jam outside. So
Correct.
we still ask, how can this happen? And I think all the participants today are here, and I'm very grateful to be here.
Thank you so much, Doctor. All right, Doctor. When it comes to eating patterns and dieting, there are so many sources of information that might contradict one another. For example, some sources may say that fasting can help with improving our blood sugar levels and maintaining a healthy body weight. But some sources say that fasting can mess up our metabolism and digestive health. What do you think about this?
That is really a good question. I think why not if we continue to listen to my talk afterwards. I'm going to talk about this point afterwards.
All right. Okay. I'm sure our audience are also very eager to find out more from you regarding our topic today, which is Ramadan fasting and digestive disorder. Therefore, without further ado, I will now pass the floor to you, Dr. Chieng.
Okay, thank you. Thank you, Fatin. Ladies and gentlemen, a very good evening to all of you. First of all, I just want to ask Fatin, is it clear here?
Yes, Doctor.
Can you see my PowerPoint here?
I think you will need to present first to share your screen.
Okay. Can you see my screen now?
Not yet.
Not yet. Okay. Now?
Yes, can.
Can you see the screen?
Can, Doctor. Just need to present one. Yeah, all right.
A very good evening to ladies and gentlemen. Thank you to Karen and Fatin to invite me and the Pantai Hospital Ampang to be here to share with you about Ramadan month and digestive disorder. I would say Ramadan month is a holy month for the Muslim to fast. And the month of Ramadan is a religious festival, and fasting is mainly a ritual for Muslims to practice self-control and self-discipline. And every Ramadan month, I would say, I really salute to my Muslim friends. How come they can fast for a whole month, you know? And just now, Fatin, you talk about when we fast, we'll feel maybe we giddy, we tired, or hungry. So how can you last for more than 12 hours a day during the Ramadan? I can imagine that if I late eating or late taking the meal for just maybe just a few hours, I will feel very hungry or even hypo attack, you know. So I would say during the month of Ramadan, eating patterns change. Individuals consume two relatively large meals, one before Sahoo and the other one is after the sunset, which is iftar. So once we heard about the Ramadan, we know about the favorite food. I tried to Google online and see what are the favorite food during the Ramadan in Malaysia. Oh, we look at all these pictures. I would say during Ramadan is my favorite month as well. You know, All the Ramadan market I go, I was searching for all the delicious food, and you look at this picture. These are what I do, and we know this roti, which is so nice, and we know nasi lemak, lemon. Wow, all the colorful and delicious 𝐴𝐸𝐺 and sweet trees. And of course, the roast lamb. I would say all of us, when we look at all these favorite food during the Ramadan, all of us are, we are hungry now. And I would say that is my favorite food during the Ramadan. But the food consumed during Ramadan is usually rich and high in proteins, like 3 times a day. And when I talk to my foreigner friends, you can see all the different variety of food which are very delicious, colorful, and nice looking. Wow, all this 𝐴𝐸𝐺, you look at the colorful satay, or you look at the lamb. So the fasting of Ramadan can improve a person's health, but if the correct diet is not followed, or one may possibly get some ailments related to the digestive health. Deciding factor is not the fast itself, but rather what is consumed in the non-fasting hours. One may actually gain weight instead of losing some during the month of Ramadan. What do you think, ladies and gentlemen? During this month of Ramadan, you think most of the time you gain weight or you lose weight? And I think that's really a great topic which we can discuss next time, maybe do a research and see how many percent of friends who who fast during the month of Ramadan will gain weight or lose weight. And those who are physically active during the month of Ramadan appear to cope better than physically inactive individuals. Fasting may precipitate or exacerbate gastrointestinal complaints. And most of the time, during the month of Ramadan, I can see some of my Muslim friends who come in, present with some symptoms of indigestion and heartburns. So of course, Ramadan month brings a lot of medical benefits to our health. And I think this point, most of my Muslim friends, all of you, you know better than I, that it brings a lot of medical benefits to our health. During your first fasting week, you'll feel sluggish and tired because your body needs to work harder than usual. And at the same time, you need to fast. Without food for the energy, the first thing your body will use up is the glucose stored in your liver and muscles. So all about the sugar in your liver and muscles will be used for the food for the energy that should be used later. For a good time for Mr. Fat to add his action, right? So the burning of the fat for energy aids weight loss and lowers your cholesterol level. So during burning to reduce your weight and lower accumulate in your blood vessels, and it's the risk of heart attack and stroke. So let's say if we lost weight, what will happen next? Yes, Fatin just now has asked about this question. Will it control the diabetes and blood pressure? The answer is weight loss results in better control of diabetes. That means your sugar level will control better. And or optimize your fast time, few hours to digest the food. So during the fasting month, you fast for more than half a day. So this is time which your digestive system will get to take a much needed rest, allowing it to cleanse and repair itself. And there's a research from China by the Qinghai. They found that during the Ramadan associated intermittent fasting, there's a remodeling of gut microbiome. This is a study which involved 30 volunteers. They collect the stool of the volunteers on the first day during the Ramadan and the day 15, and then followed by the day 30. And then they will check how much of bacteria inside the stool collect from these 30 volunteers. In conclusion, they found that intermittent fasting provokes a substantial remodeling of the gut microbiome in the healthy volunteers. That means they will try to keep the good bacteria in our colon and in our stool, and which is very good for our health. This is what we call as Lactobacillus species. And so we know about there are a lot of groups about the fasting Ramadan. So we look at Ramadan month and the digestive problems. We know there are a lot of publications and papers published about this period. All the acid and the content will go into your food pipe, and then you'll feel the discomfort over your chest wound. And also it may feel like perde ulu hati. You may feel nausea, or we call loya. And some of them may feel rasa terlekat di kerongkong. That's why some of the patients may go to see the ENT doctors. Or even they go to see the dentist, in which the reflux, the acid may cause some problem to your dentures. And of course, they may cause the cancer to your the throat cancer as well, which some patients may see the ENT. And some patients may have the heartburn, they feel the discomfort over the chest, and they go to see the cardiologist. So what are the foods that can aggravate or provoke the GERD symptom? By looking at this picture, we know that a lot of our favorite food that can provoke our reflux symptom. For example, we look at the coffee. Wow, a nice coffee. And here I would like to emphasize that no matter it's the caffeinated or decaffeinated coffee, both of them can cause the reflux symptom. And of course, some like limau, citrus juice, they can provoke the reflux symptom. Tomato, bawang merah, all the chili, spicy food, carbonated drink, or the oily food like fried chicken, which all of these are favorite food of Malaysians. All these food may provoke the reflux symptom. And next, we would like to look at another common disease which we can see during Ramadan fasting. Ulcer inside the stomach is another very common symptoms or findings. Just want to share a little bit, like today I've seen one patient coming with the vomiting blood, and I've performed the endoscopy for him today afternoon. And we found there's an ulcer over here, which is quite a huge one, and is with a minimal oozing of blood. And further asking, this patient seldom take the meal regularly. So we'll see these type of patients, they usually have a fatty ulcer disease, and they may present with symptoms like abdominal pain or even bleeding, or some of them may have loss of weight. And let's say if this fatty ulcer is not treated, they may lead to the complications. What are the complications of fatty ulcer disease? We know it can cause bleeding, pendarahan, and some of the patients may vomit blood, and some of them may just pass out a blackish stool. The black stool like your hair. And initially, a lot of patients, they don't realize that this is a bleeding from the ulcer. But actually, instead, this is one of the signs for the fatty ulcer disease which bleeds. And besides bleeding, they may cause the perforations, kebocoran. That means the wall inside your stomach has leaking. And this type of patient may feel the abdomen grossly distend and pain and discomfort. And definitely, if there's a chronic ulcer, they may slowly progress to the cancer. And this patient may need surgical intervention. So we look at another study which has been done by Morocco University, is the effect of Ramadan fasting of acute upper gastrointestinal bleeding. So from this study, they found that the commonest cause of gastrointestinal bleeding was peptic ulcer during the Ramadan. However, Ramadan fasting itself did not influence the outcome of the patients. And they suggest those patients with risk factors for peptic ulcer disease, they should take some prophylactic measures. For example, some NSC, some gastric medicines. Some patients with risk factors for ulcers, they should be careful and they should see the doctor for assessment. And some of them may need some prophylaxis gastric medicines. So until now, I think some of the participants, you may be query about, can I fast if I'm diagnosed with peptic ulcer disease? This is one of the common questions during the Ramadan month. And I even, the uncle that I met, the budget that I met just now is also a Muslim patient who have the vomiting blood, and we found there's an ulcer disease. I would say the question of whether or not fasting should be recommended is difficult because the physiological changes during Ramadan are not precisely known. And different patients, they may have a different presentations. Some of them may easily have the bleeding, but some of them may not have the bleeding. Therefore, the questions should be personalized, and we have to assess the patients one by one and to see whether he or she has the risk factors and whether he or she require any prophylaxis medications. Next, let me introduce about the liver and chronic liver disease. What should you do during the Ramadan month? Cirrhosis, that means it's a replacement of the normal liver tissue by the scar tissue. That means hardening of the liver, and the liver does not function properly due to the long-term damage. Typically, this type of disease, they develop slowly over months or years. And I would say most of them because of hepatitis B, hepatitis C, or some of them with the alcoholic are the major etiologies. And for your information, fatty liver emerge as common cause for liver cirrhosis nowadays. By looking at these two pictures, you know the left side is the healthy liver, which is shiny and pink color, while the right side, you can see the surface is very rough and not smooth, they are hardened. So this we call as a hardening of the liver. So this is another study which I'm going to show with you, effects of Ramadan fasting on Muslim patients with liver cirrhosis. It has been performed at Egypt in 2017. They divide the patients into 3 groups. The first group is those who have a liver cirrhosis who fast during Ramadan. And the second group are those liver cirrhosis are advised not to fast during Ramadan. And the group 3 are the healthy fasting volunteers. Surprisingly, they found that patients with liver cirrhosis, they show changes in their liver function and portal hemodynamics, irrespective of their function status. Therefore, we could say that if we carefully pick out the patients who are suitable for fasting during the Ramadan month, we can avoid a lot of other complications, and it is quite safe to be practiced among patients with liver cirrhosis, especially those with stable liver problems. So this is another guideline by the Egyptian Ramadan fasting liver disease interest group. They found that, let's say those who have a chronic liver disease, they come to see the doctor, they suggest they should be evaluated 1 month before the Ramadan. And the doctor need to examine the patients and do some investigations like blood tests, ultrasound scan, and even sometimes maybe some endoscopy. So in general, we know that we divide the chronic liver disease to 3 classes, A, B, and C. A means mild disease, B is a moderate, and C is a severe. And those with A, most of the time, they can fast. They can fast with the cross observations. B and C may not be fit enough to fast because these type of patients, the liver function are poor. and they may have a lot of complications, let's say if they fast. So next one, we will talk about the acute gastroenteritis. This is another common presentations of the patients during the Ramadan month. We can see a lot of patients coming to emergency department with 𝐷𝐻𝐵𝐵, diarrhea. We know that diarrhea occurs when the food and nutrients passing through your stomach, through your small bowel, large bowel, move too quickly and exit the body without being absorbed. We know that normally we ingest the food until we pass out. Usually it takes about at least 6 hours. But let's say if there's a diarrhea, they may pass out frequent than usual. Diarrhea is loose, watery stools 3 or more times a day. That means if your 𝐷𝐻𝐵𝐵 more than 3 times or better per day, and it is loose or watery, we will call that as diarrhea. Diarrhea during fasting may cause side effects, such as dehydration. That means not enough water. You pass out too much water until you're dry. Malnutrition, that means kekurangan zat makanan. A lot of nutrients has lost from your body. Malabsorption, especially if you have chronic diarrhea. Cramping, that means you have pain over your tummy. Nausea, that means your mau muntah or loya. And dizziness, you feel burning, headache. All these are the common side effects during the diarrhea. And let's say if this type of patient come to us in the emergency department, as a doctor, what are we going to do? And here I just want to share a bit of a hint about how we are going to assess for the patients with diarrhea. And you can practice at home as well during your Ramadan month. For adults, usually, if they have dehydrations, they may have headache, fainting, tiredness, they feel very thirsty, they keep drinking water. If you can drink, that is good. But let's say if you cannot drink, you must go and see your doctors. And some of them may have muscle weakness, and they found there's a tea color urine or urinate litter, especially in elders. And infants or young kids, they may usually sleepy and drowsy. They tell, Mama, I'm very tired, I want to sleep. Or some of them may keep crying, but not producing tears. They're crying, no tears. So they are dry mouth. You look at the tongue, it's a dry tongue. And some of them may have fever. And of course, for the babies, you look for the diapers. You see any diapers every 3 hours. Is it dry? Let's say if it is dry or just a minimal urine, so you should be careful. Your baby may be dehydrated and you need to get some medical attentions. So how to reduce our risk of food poisoning during Ramadan? Of course, maintain a good hygiene. Wash and disinfect fruit and vegetables. Avoid raw or uncooked foods. So be careful about this point. And have to prevent the cross-contaminations. Use a different cutting boards, a knife for different types of food. And wash your hand before you're touching another type of food items. And change your gloves if you use. And of course, always look at the expiry date. Respect use by dates. This is by the British Islamic Medical Associations. They will point out which type of patients shouldn't go for fasting during the Ramadan, or those patients who should pay attention and be careful, or those patients who are fit to go for fasting. This for gastrointestinal disease. They found that those patients with advanced liver cirrhosis, like I mentioned just now, stage B and C, be careful. Or those who have a recent liver transplant, active inflammatory bowel disease, acute or chronic diarrhea, or those who have recent surgery, should be careful. You may not fit for the surgery, for the fasting. And others, it will depend on the situations and the personal conditions. Here, I'm going to share a bit of tips during the Ramadan month. I would say this is a favorite food during the Ramadan. Begin iftar with dates, providing you with an immediate source of energy. We know that dates brings a lot of benefits. It has 0.6 gram fiber, 20 calories, 0.2 gram protein, and the best one is 0 gram of fat. This is very important. But be careful, don't overeat that, as if you eat too much, it may bring to other problems, especially if the patient is diabetic patients. No? So usually we suggest maybe just 2 or 3 dabs should be fine before you start or begin your iftar. Hydrate well is very important. Make sure you drink enough water. For an adult, you need about 2 to 2.5 liters of fluid. And of course, for those who have a kidney failure or dialysis, or those who have a heart failure, if you're on fluid restrictions, you should be careful and please get the advice from your doctors. And avoid carbonate and fizzy drinks. And of course, caffeine during Sahoo. Caffeine, it can help you to urinate, and it makes you urinate frequently, and of course, you feel dry easily. And good night's sleep, make sure you sleep enough. And I found that a lot of patients during the Ramadan month, they sleep quite late. I would say try not to sleep too late and try to finish your eating 3 hours before the bedtime. And make sure to steer clear of high-fat meals or caffeine-containing beverage close to bedtime. And limit your salt intake or all the Ajinomoto, garam, you have to minimize. Salt is a diuretic, and higher salt intake can lead to more water loss and dehydrations. And of course, if you take too much of salt, it may cause you having the high blood pressures, and that will be another problem. And more fruits and vegetables, which is healthy and fresh. And never skip Sahoo. As the saying goes, breakfast is the most important meal of the day. So breakfast is very important. Please never skip your Sahoo. This morning, I've met with another auntie, Majid. Majid said during the Ramadan month, she only take 1 meal. She skips Sahoo, and she's a diabetic patient. I would say that is very important. Please take twice for during your Ramadan month. And it's very important, which make you fresh and energetic, and it may reduce the risk of a lot of medical problems. And of course, never rush your meal. Once you buka puasa, don't rush eating. Chew slow, chew well. So here we're going to talk about this. How many hours you spend for eating and drinking per month? As I talked about, don't rush your meal just now. How many hours you spend for eating and drinking per day? I Googled around and look at this study. It's very interesting, where people spend the most time eating and drinking. France, 2 hours and 13 minutes for the day. Italy, 2 hours and 7 minutes. Spain, 2 hours, 6 minutes. How about Malaysia? What do you think? How many hours do you take for drinking and eating per day? 1 hour? 2 hours? Or 3 hours? I would say, I believe most of the Malaysians maybe spend just 1 hour, maybe, I think. Accumulatively, maybe just 1 hour. What do you think? I think the answer is in your heart. You know about that. So last but not the least, we know about the tips for a balanced Ramadan diet. Have a mindset of wanting to live a healthy life. If you want to be healthy, you'll be good. And start your meal with fruits or eggs, dates. And take small portions or small pieces. And go for sugar-free beverage and foods. Increase fruit intake. And remember, never forget about the fruits and vegetables in your meals, which are very important. I think that's all for my talk today. Hopefully all of you enjoy. And if you have any questions or comments, you are free to put here, and we're going to discuss about this. I will try my best to answer your questions.
Thank you, Doctor, for sharing all that information with us. From your sharing session earlier, I noticed that a lot of these digestive issues, especially during Ramadan fasting, are also caused by poor eating habits and poor food choices. Especially now that Ramadan is coming and that we are so rich in choices of delicious food, right? So I'd just like to remind our participants here, especially that now Ramadan is just 1 day away, to always choose the healthier food option to avoid and reduce the risk of digestive disorders. Okay, doctor, are you ready for the burning questions from all of our participants?
Come, let's burning.
Okay, so the first question, can we eat Gaviscon in the Sahoo to prevent gastric?
Okay, so now we'll talk about the preventions. First of all, I would like to know why you need preventions. As a doctor, usually will see the patients, especially those who are elder or those who always have a gastric problem or history of bleeding, ulcer disease. These type of patients, and another point is those who are on medicines like aspirin, Plavix. These type of patients, they are more prone to have gastric problem. So for these type of patients, we may encourage to take some medicines to prevent gastric symptoms. I would say the Gaviscon is one of the NSAIDs that is very useful and you can purchase at all the pharmacy outlet or carry. And yeah, I would say Gaviscon is one of the methods that can help you to prevent. But have to be in mind that Gaviscon may be a short acting and it may not last for a long time. So usually I may suggest for some other medicines like famotidine, or maybe some proton pump inhibitor like pantoprazole, esomeprazole, and so on.
Okay, thank you, doctor. Our next question is, what should we eat for the first meal after Ramadan? I believe this question is for Raya, the day after the last day of Ramadan.
Sorry, do you mind to repeat the question?
Okay, the question is, what should we eat for the first meal after Ramadan?
First meal after Ramadan.
Mm.
I would say in general, you just follow my suggestion just now. Eat slow and never rush, and all the healthy food and reduce all the sugars, salt, and make sure you rehydrate well. I think that should be sufficient. And I think it's difficult to tell you which type of food is the best for you.
I agree. I believe it's the important thing is to have a balanced meal.
Yes, I think yes.
All right. Next question. After all the delicious food, beside water, what is the best drink to wash down the fat and oil?
Okay, best drink, I would say always sky juice is number one. That means the plain water is always the best. Best of the best. But here I would like to emphasize some of the tips during the daily practice. Some of my patients, sometimes they have some reflux or heartburn. I would suggest them sometimes they may try apple cider. Sometimes they can try in the morning time to help them have a fresh day, and it has been proven that it may reduce the risk of heartburn. About the drink, I would like to say you have to avoid all the caffeine drink and all those like citrus, like orange juice, lemon juice. Please try to minimize it.
Okay, thank you, doctor. Next question. Is taking gastric pill considered puasa is batal? Okay, I will answer on behalf of you, doctor. So taking any form of pills or inhalers, syrups, pessary, suppositories, enema, or injection is going to nullify your fast. Okay, so meaning to answer that question, in short, it will batalkan your puasa. All right, next question. Does fasting has any impact to the kidneys?
Okay, so now we talk about the kidney. Of course, if you're fasting, you will have a bit of impact on your kidney. But let's say if you're during the buka time, you have enough rehydrations, the water still can retain in your body and still can make sure you have enough water supply. I would say usually most of the time it won't affect your kidney function, unless for some patients who already have underlying kidney problem. That's why we encourage all the adults, please, you should go to have an annual medical checkup to see what is your baseline of your kidney function. I think that is very important.
That's true, doctor. I think a lot of people, especially since we've been undergoing so many lockdowns, right? People tend to neglect going for medical checkups. So please go for your medical checkup and check for your current health status, yeah?
And I would like to share a bit about nowadays. And you know, after the MCO, we sit at home and eat this and eat that and drink this and drink that. Nowadays, a lot of patients come back for medical checkup and we found that, oh, how come my cholesterol is so high? How come I have diabetes and so on? I would say all these are very common nowadays. Please go and have your medical checkup and it will help you and prevent more severe medical problems.
True, true. Okay, doctor, next question. I get diarrhea every day during fasting. How do I manage this?
Okay, so number one, what is diarrhea? Diarrhea means you pass out watery, loose stool 3 times, more than 3 times a day. That means diarrhea. So diarrhea, first of all, we need to find out why there is a diarrhea. And just now you mentioned that diarrhea only happened during the fasting month. So therefore, we must find out why there is a diarrhea. Is it because you have food poisoning? Or maybe the food that you took and during your buka puasa causing some problem to your digestive problem? Or maybe you already have underlying colon problem or digestive problem? So I would say this question is very tough to answer, but we need to assess personally and see what's the problem so that I can help you.
Okay, doctor. Next question. I'm suffering from Gerd. I'm fine during fasting hours, but the moment I break fast, I feel fainty, sweating, my heart pumping faster, and heartburn even if I eat a little.
Yes. So let's say if you always have heartburn, I would suggest you may need to see your gastroenterologist for detailed medical checkup. And let's say if you have a history of the GERD or reflux disease, you may require some medicines to prevent or prophylaxis during your fasting Ramadan. A lot of my patients will come back 1 month before Ramadan, and then I will put them on some NSCs, gastric medicines for prophylaxis during this 1 month. And most of them, they will feel good during this period. And of course, during buka puasa, it's very important. You have to eat slowly and not to rush. And healthy food is very important.
Okay. Okay. Thank you, doctor, for addressing that question. We have more coming. Hope you are ready. All right. Next question. So fasting during Ramadan, is it like intermittent fasting to lose weight? Is it good for overweight or obese and diabetic people?
Yes. Intermittent fasting actually is one of the method to try to control the weight. And a lot of studies, they found that it may have some benefit on controlling the diabetes, high cholesterol, and control the body weight. However, how are you going to fast? That should be personalized. And you shouldn't say, how come Mr. A fast for 20 hours per day? And so I want to follow the 20 hours. I would say that is not correct. You have to see your own conditions, see whether you have underlying diabetes, heart problem, asthma, kidney problem, before you're going to do intermittent fasting. And you should be careful that once you start your intermittent fasting, once you buka puasa, you have to know what type of food have you taken and what you have ingested. And that food may play a very important role in controlling your sugar or lipid profile. So I think the intermittent fasting, it could be another very big and interesting topic to discuss about that.
Okay. Next question. Is probiotics good for GERD?
Yes, this is a very interesting question. And every time during this topic, of course, it will be bring out about the probiotic. We know that the probiotic is a very great topic and it's a very hot topic among gastroenterologists for these 10 years. Yes, a lot of studies, they found that probiotic or prebiotic or symbiotic means combination of pre and probiotic together. So they found that probiotic has a lot of benefit in controlling the digestive problem during the Ramadan fasting. So I would say probiotic is one of the ways they can help to prevent all these digestive problems. But of course, you have to know which type of probiotic you are taking and what's the dose that you inject. And that is very important.
That's true, doctor. Working in a pharmacy, I can tell there are so many different types of probiotics, and it's important to know what is the most suitable one for you before you decide to buy.
Yes, and I think besides the type of probiotic, we need to know the dose and how you're going to ingest. And please remember that not everyone used to take probiotic. I just want to share a bit of my experience. A few weeks ago, I have one patient came to me, and he likes probiotics, so he took few types of probiotic together.
Okay.
He took a few bottles of the different types of probiotic. I would say, please, sometimes, yeah, probiotic is good, but you have to know what are you going to take and try not to be overdose, right?
True, true. Sometimes when patient or customers feel like something is good for them, they tend to take a lot of it in one shot.
Yes.
Okay, doctor, next question. Does date milk scientifically help our gastric problem during fasting?
You mean the Dex milk, the favorite milk?
Kurma, yeah, I think.
Okay. All right. Now we talk about milk and Dex separately. Dex, as I mentioned just now, is a very good starter when you book up puasa. You take 2 or 3 Dex, is very good for you before you start your iftar. So if we talk the other one about the milk, I would say milk depends on which type of milk you're taking. Of course, if you have high cholesterol, low-fat milk may be more suitable for you. And be careful of some of the powder milk in the market. Some of the powder milk, they may cause a lot of bubbles you see when you pour in. And if you take it, you may feel a bit of bloating. So here I would like to suggest, if you can, please take the fresh milk, or those who are produced by the pharmaceutical company and specifically for special type of patients, like diabetic patients, they have special type of milk. So I think that type is a very good one. About the Dex favorite milk, sorry that I'm not comment about this because I didn't see any obvious evidence on the benefit of the health.
Okay, thank you, doctor. Our next question is related to medications. So even patients on aspirin or clopidogrel or other blood thinners can fast with food at sahur, and how to know what dose of insulin is suitable during Ramadan fasting?
Okay, about some blood thinner, like maybe aspirin, clopidogrel, I would say if you're already on this type of medicines, please, you have to follow your doctors. Please continue the medicines. And at the same time, you may need some medications or gastric medicines to prevent you having ulcers. So during this period, you may go back to see your own doctors, get the advice if you need any proton pump inhibitor, for example, pantoprazole, esomeprazole, lansoprazole, to prevent you from having gastric problem. You need to go back to see your doctor for this.
Okay, doctor. Together with that question, it came with another separate question. How to know what dose of insulin is suitable during Ramadan fasting?
Okay, regarding the insulin, that means you have diabetes. So we know during buka puasa, we have iftar and sahoo. So usually the insulin, it depends on which type of insulin are you using now. In the market, we have, in general, we have short acting. Short acting means they only cover for 4 to 8 hours. And long acting means they cover for 24 or 36 hours. And mixed type, that means they have short acting and intermediate together. And the other one, they could be the intermediate acting. So there are different types of insulin in the market. So I would say in general, let's say if you have diabetes, before Ramadan, you should go back to your personal doctor and your doctor will adjust for you. For example, if I have a patient who is on the once daily insulin, that means only 1 dose per day, usually I will advise my patient to take the insulin during the heaviest meal. Let's say if the patients take the heaviest meal at night, I would suggest take insulin at night. If the patient take heavy meal in the Sahoo, I will advise him to take insulin in the Sahoo. And usually, we no need to reduce the dose. Usually, no need. Unless if you think the patient is very high risk or hypo, or if the patient is very fragile, old age, and then you may consider to cut down about 20 or 30% of insulin dose. How to adjust the insulin, it depends on which type of insulin you are using. And do you have other comorbidities?
That's true, doctor. Especially for diabetic patients, it's also important for you to constantly observe what symptoms or how you are feeling, okay? Because we don't want you to be experiencing hypoglycemia. So it's always important to know what are the symptoms of hypoglycemia and what you should do when you do experience these symptoms. All right, doctor, next question. Is it okay if I want to do juice fasting during Ramadan?
Juice fasting. Yeah. May I know what is the meaning of juice fasting?
I think juice fasting is mainly you don't consume any other types of food or solid food, and you only consume juice during the whole of Ramadan.
Yeah. I think if you only take the juice during the fasting month, it may not be sufficient to supply all the nutrients that you need or you require per day. So of course, I will still suggest you, if you can, you still need some solid food to support you.
That's true. And that also goes back to doctor's tips and recommendation earlier, which is to have a balanced meal. It's very important to have a balanced meal. So because when we look at fruit juice, it's mainly just fiber, and not to forget, fruit also contains sugar. So if you only drink fruit juice throughout Ramadan, you're not getting the carbohydrates, the proteins, and all the other important food groups as well. Okay, doctor, maybe before we end our session, we have one last question for you.
Okay.
Is ensure milk good to take during Sahoo?
Okay. Ensure milk, we know there are different types of ensure milk, and some of them are specific for diabetes patients, and some of them specific for stroke patients. Of course, this milk can provide a certain nutrient for you, but I think if you only take the milk, may not be sufficient during the Ramadan month. You still need a variety of food to support you for the whole day.
Okay, that's true. Okay, doctor, before we end the Q&A, do you have any advice or tips or recommendations to our participants today?
Finally, thanks again to all the ladies and gentlemen to attend our talk today, and hopefully you learned something, and I have learned a lot here as well from Fatin and all the participants. And thank you again to Karen for inviting us to be here to share the topic with you all.
Thank you so much, doctor, for taking the time out of your day, out of your Friday evening, to share all your insightful sharing and all your knowledge with us. And I'm very sure that our participants have learned a lot from you also.